Hi everybody, it's Andrea, and I thought I'd give an update on what's going on. Right now, I am going to physical therapy to help with the spasticity in my back and in my stomach. As you all know, that I've been living with the hug forever. And so the doctor, I had said in my last video, was feeling my back and saying it was very spastic. And so I'm going to a physical therapist who is working on building up my trunk and core strength, in feeling around my muscles and stuff, especially in my stomach. Very spastic. And it looks like my abdominal muscles are atrophying. And that's why I have kind of a weird shape when I take off my shirt. It's kind of hollow in weird areas, and I have a weird lump on the right side, and I just look out of whack. And so now I'm doing these exercises to kind of strengthen them and my back, and to be able to support myself properly, I guess is the right way to say it. One thing that I found interesting is, you're lying on the table. It's kind of a manual therapy and doing, really isolated exercises and that type of thing. And when she was pushing down on my stomach, when I'm lying down low, right below the hip bone in the groin area, pushing on that, it was like excruciating pain. And I always thought it was, you know, scar tissue because I did have a hysterectomy years ago. And I just didn't really think about muscles in that area. And what she explained to me was where that is, and she pulled out a little picture so I could see, is that muscle down there is actually the muscle that goes down through your thigh and actually helps you lift your leg. And my right side is the weakest, and that's the side that hurts so much. And so I'm doing a lot of lying on the floor and doing the crunchies where you pull in. It's like a reverse crunch. I don't know how to explain it. And I don't feel like getting on the floor and showing you, but and just doing those type of exercises to help build my trunk strength, basically. And it's too soon to say, um, but I haven't had a really bad spasm since I started this. I'll get small ones, but now I know certain things to do. I can push on it and get in a certain position, and it'll slowly ease up. So for any of you who have those type of issues, it's something to check into. And hopefully it will reduce some of the pain I have from the hug, because I think the spasms are what is intensifying it. Like I said before, I would get them where it felt like I was having a heart attack. And so that's what I'm doing with physical therapy. The next thing is, it looks like I'm probably going to be going on Tysabri. This is all depending on insurance and cost and types and things like that. I'm not sure what my insurance will cover and if I can afford it. They do have a copay assist plan, and so they're working with me. I do have a gal who I talk to who would be my, I guess, case manager in the touch program. So I talked to her for some time, and I talked her ear off, and she was really very nice and fairly honest with me, I believe, asking a lot of questions. And everybody is always, or at least from what I've heard and stuff, I always felt that you're fairly safe for 2 years, and that's when the risk goes up. She did tell me that it's literally about a year, and then slowly your chances go up. And then when you hit the 2 year mark is when you get into the it's almost 2 to 1,000 who contract PML. So that's a lot to take in. And I'm not going to lie, it is scary for me, and especially because of Angela, and to actually know somebody who has gone through PML. Um, so I don't take this lightly at all. But I've been weighing it back and forth, and for me, right now, it seems to be the only thing out there that truly, really stops or drastically slows progression. And everybody knows Vern and how well he is doing on it, but I have a lot of other friends. And a lot of them that I've talked to for years from another board that I belong to. And I post there because I feel I can be a little more honest about certain things without being attacked. It's my safe place. And many of them are on Tysabri and have had really, really good results. And it is a quality of life over quantity of life issue for me. To not do anything is just as scary as going on Tysabri. So that is where I'm at right now. I will be paying very close attention to my body. I'm very attuned to things. And I'm one of the people that whatever med I take, I seem to get the side effects. So I'm hearing from most people that the side effects are usually a headache afterwards or itching and that type of thing. And those type of things I could deal with. But if I find that I am getting the infections and some of the other more serious things, I will stop it, because for me, that is not quality of life. Like I said, when I was on Avonex, other than having relapses, pretty severe, I was sick the entire time. I was one of those people that could not tolerate the drug whatsoever. And that was no quality of life for me. So that's what it looks like I'm going to be doing if I can afford it. I talked this over with my neurologist, and I was really honest with her, and I, asked her, if it were you or somebody in your family, what would you do? And she was honest, and she said, there is the small risk out there, but as far as stopping progression or at least slowing it drastically, Tysabri is the thing, and I would go on it. Being monitored carefully, obviously. And then when you hit the 2-year mark, that's when you have to really decide. And so we talked back and forth. We did talk about Gilenia and the fact that it is so new, and just for myself, and my doctor agreed that not knowing long term what kind of side effects or benefits really there are to it, that it's just a little too new for me. We did talk about the other crab drugs, and I was surprised that, because I told her, for me personally, and reading some of the studies over the 15-year period of watching the people who chose nothing and the people who chose one of the DMDs, that in the 15-year study, there was basically no difference in either group. And she even said, well, nobody really knows for sure. Maybe for some people they work, but it could be also that person's course of the disease. So I do have confidence in my neurologist, and she doesn't seem to mind me asking all the questions and being well informed. So I'll see what happens, and if I do decide to go on it. If I do go on it, I will let you all know, but Unless something drastic is happening, I'm not going to be doing weekly updates about how I'm doing on Tysabri. So there's that. I do have kind of an off-the-wall question. And it might be just a stupid question, and I admit it, but I was just kind of like thinking. With CCSVI, we all know that having good blood flow is good for everybody, especially in the brain area. And if you have stenosis or whatever, and it's keeping bad blood in there and causing damage, that type of thing. Okay, now here's my weird question. If you've had the venoplasty to open that up and things are flowing, and you are on, say, something like Tysabri, with the blood flowing properly and things getting out better, do you think that would impact your chances of getting PML? If things are going better and flowing better and not stagnating in the brain, would it possibly reduce the chance? I know that sounds weird, but you know, when you're trying to piece all of this together, you're looking at everything. I agree with Judy that there are so many different aspects that you have to look at all the different ones. And doctors for so long have been so focused on the whole autoimmune thing that this, with CCSVI being acknowledged to some degree, it is a component, I think. And you have to look at the whole picture. And to me, having better blood flow and stuff not staying in there, it was just a question I had, and you can all tell me whether I'm stupid or not, but it was just a question. So there you have it. I think that's about it for now. I'm really debating, I guess this isn't all there was, whether or not I should keep the channel up. Since I really don't know what people want to talk about anymore. You've got the before and after CCSVI people, which I'm very happy for all of them. And then you have the people who are doing their Tysabri updates and that type of thing. And my whole goal for this channel was to talk about multitudes of things, like my physical therapy and how, you know, what's going on with me could possibly give you an idea to maybe check into it. So I would like some feedback if you even think there is a place for this channel anymore. And if so, what would you like to talk about? I'm open to everything. I will talk about CCSVI. I will talk about Tysabri, Gilenia, Aminex, Copaxone, Rebif, Betaseron, whatever. But I don't want people to be excluded from this channel because that wasn't my goal when I created it. I wanted this to be a support group. And there's been so much divide lately. And it's really bothering me. And I just want to know what your thoughts are. And if you want the channel to go on. And if so, what do you want to talk about? So there. That's it. Leave a response. Do a video response. Whatever. Talk to you soon. Signing out for now. Bye-bye.